There he is.
Hi.
I'm so happy. This last time it didn't work out when we were with Bill Duke, so I was a little nervous.
I'm glad it worked out just fine.
So everyone, I see you, Erica. My sister's on here. She was with us when we interviewed you, so I'm excited. And we also have someone who's saying hello to you already. So we have I don't want to, I just, there's so much I want to say about this wonderful human being, but I had to write it down so I can condense it. Just so you know, you guys, I'm taking him out of retirement like Michael Jordan. um, so Paul has worked in a variety of health and mental health related, and I kind of stole some of this from Mental Health America because they condensed it so it was easier.
Right.
He has worked in the course of his career spanning over 40 years. And as a member of the State House of Representatives, he led Connecticut's Joint Appropriation Committee's Health Subcommittee. And it was his first opportunity to impact mental health policy, which we'll talk about as well. He went on to build a career around improving the mental health delivery system, working as a consultant, nonprofit leader at Mental Health America, and not just in one area, the United States. He was the president and the CEO. He's a speaker, he's a writer, and the author of an amazing book called Losing Tim: How Our Health and Education Systems Failed My Son with Schizophrenia. I have to choke up sometimes. But Paul also coined the phrase before stage 4. So if you see that hashtag anywhere, just know that it was him who created it. How I met Paul was while I was doing research on my mental health documentary, The Call, my search for answers from my dad, and then my brother, and sadly now we're going through with my stepdaughter, as many of you know. And not only did I connect with him because he's from up north as well, he was the former mayor of Connecticut, but also it was a personal story for him as well. And I love that he was walking the walk and not just talking the talk. And so we'll get into that a little later. But, in addition to um, him going out there to speak for everyone, he was obviously speaking for himself. So Paul, thank you and welcome for being here. Oh my God, such a blessing.
Thank
Um,
you.
I guess I want to start with the banger right out the gate. Where are we with mental health in America today? And just a quick moment of silence for the recent events. Let me just do that first. Okay. So where are we with mental health in America today versus years ago, and how much has really changed?
Well, I think we're better off today than we were 10 years ago or 20 years ago because the federal government finally became interested in mental health again. And it had been really since the Carter administration, since the federal government had put a lot of resources into mental health, but it did so a few years ago. And I think we're beginning to see some of that trickle down to the states. And the other good thing is that because the states have not had the same kind of budget crises that they had, say, 10 or 15 years ago, they weren't picking mental health to cut first, which is always what used to happen. They cut mental health before they'd cut anything else. So it was last one in, first one out on the funding side. So those are two positive things. That said, I think we have a long, long way to go in both moving people upstream, focusing in on children, and continuing to work with our school system, our healthcare systems, and others to make sure that we do early identification and early intervention for kids. And as I've said for years, and Mental Health America picked up on when I was there, we just have to act before stage 4. We can't make these the only chronic diseases we wait till stage 4 to treat, and then often inappropriately only through incarceration. We've got to act before stage 4, and I think we can pull that off.
I agree. And I was reading this, one of the places that I get a lot of information from is UCLA. As you know, they do the mental health research. And one of the things that they said just the other day was that student surveys consistently indicate that alienation, bullying, harassment, academic failure, and more widespread problems at schools, While these raise mental health concerns, the solution to addressing so many problems isn't just to increase mental health services. Indeed, a greater focus on prevention and responding with a range of support when problems first appear would significantly reduce the need for clinical services. And I know we've spoken before about mental health services in the school. Well, what do you feel is really happening now? Are we seeing more of that now? And if not, like we talked about it before, we talk about sex ed as kids before we even learn about mental health care. So what are you seeing from your perspective? Has anything changed within the school system?
Well, I'm going to say not enough. And while I think there is more lip service paid to mental health in the schools, and I think there's greater attention to the fact that, particularly since the pandemic, so many kids have had more problems with mental health, more problems with anxiety, more problems with depression, all of that. I think that there's recognition at this point about how poorly we've been doing. But I think when you get down to it, we're still in the same boat that we were in a few years ago, which is if a kid needs special education services in order to succeed academically because they have a significant mental health problem, nobody wants to put the money into that still. And it's easier to remove kids from classrooms still than it is to keep them in classrooms and keep them working toward academic success. And I think we've still got a long way to go, frankly, with school boards, school administrators, and others in understanding that it doesn't make sense to remove those kids from classrooms, to suspend and expel those kids from schools when really what they need is to be engaged with their peers, to be engaged with their teachers, to be engaged with their communities, because we all know the biggest problem with mental health and mental health concerns is the disengagement that occurs when you lose family, you lose friends, you lose jobs, you lose education, you lose all that. So we've got to fix that. We've got to think about it differently. The same way we think about cancer, or same thing we think about kids with leukemia, kids with significant disabilities, kids with academic issues only. We've made a lot of progress in all those areas over the last 30 years. We now have to play catch up for the next few years with mental health.
Yeah, so let's talk about the money. You know me, I go right to it.
Yeah. Me too.
And that's why I bonded with you, because you're a sharpshooter and I love it. And tell me, where does the money go? Because you have been so instrumental in educating me as a consultant, as one of my mental health mentors. Where does the money go? Can you educate everyone that's watching us tonight? There's billions of dollars, and from the NIMH, which is, talk to us about what that is and educate us and how it trickles down.
Yeah, so for a long time now, what's been happening is that the money that was pulled from the mental health system, starting in the 1970s and 80s, 1980s, from our custodial care institutions, instead of creating deinstitutionalization, it created reinstitutionalization. That money just shifted over to a new kind of custodial care information, or custodial care situation, which we now call prisons or jails, county jails. And still, the lion's share of dollars for mental health treatment are going into our jails and prisons.
Right.
And what we need to do, and one of the things that has happened with some of the new money, not all of it, but some of the new money that's gone into the Health and Human Services Department, is it is now going to states and localities and nonprofits for upstream services. And that's gonna pay dividends. But right now, we talk in terms of a few billion here and a few billion there. When we're talking about tens of billions and even more than that that's been going into our criminal justice system and elsewhere, and providing custodial care institution, custodial care for people. Yeah, it gives you 3 meals a day, but it's not giving you active treatment. It didn't do anything for my son. I mean, it, kept him healthy for a little while longer than maybe he would have been if he hadn't been going into jails frequently. But it didn't save his life. and it didn't help him recover. And that's really the fact for so many people, really, who are out there.
Yes. So we have some people in the comments saying, with no help to those in need.
Yeah,
Exactly. So the states are getting some of the funding, and then again, we have these, like with my stepdaughter, we have these mental health facilities, and it seems that if the federal government's not involved and the states running it, then nobody's policing these facilities. And that's why she ended up, being shipped off to somebody who basically dropped her off at the bus, I mean at the train station. And so it's like, who is watching who? You know what I mean? So
yeah,
like, why is that happening? Why is it that, okay, so I know that Kennedy, back in his presidential services, he signed the Mental Health Care Community Act, and trying to get everyone out of, like you said, the institutions and onto mental care facilities. And then obviously that got, sadly, he was assassinated 22 days later. That didn't happen. And every president after that tried, maybe not. Maybe Carter was the only one. And so, what do we need to do now to get back on track? Because it just seems like, like you've mentioned before, we're just chasing after the fact instead of getting in the front end of it. And, how do we do what your phrase is, before stage 4? What do we need to do?
well, I always start that answer by saying we just should be screening everybody. Yeah, I'm going in for my physical, on Monday or whatever, and they have me doing a PHQ-9. People don't know what that is. That's the basic depression screening tool, and that's new. I mean, they weren't having us do that on a regular basis some time ago. Now, my diagnosis happens to be anxiety, so I often tell my primary care physician I should be doing the GAD-7 instead of the PHQ-9, but we'll get there. So eventually we need to get there and not assume that every mental health condition is depression. And so what, but I think one of the things that we have done, and somebody pointed out in the comments that, it is billions now that are going into the block grants. And it was Patrick Kennedy and I who basically a few years ago, said to a lot of our colleagues, let's not be satisfied as we hit the pandemic. Let's not be satisfied with just asking for millions anymore in the block grants, even hundreds of millions, which seems like a lot to people. But when you spread it out over the whole country, it's not very much at all. And we were very successful, a whole collaborative of mental health advocacy groups, including Mental Health America, NAMI, and Kennedy Forum, and the National Council, and others all kind of got together. The APAs all got together and said, "Let's do billions." And so we had a great person, frankly, in the Appropriations Committee at that time, Rosa DeLauro, who was my member of Congress, who said, "Yeah, billions is what we need to do." So she put it in. It'd be nice to get Rosa back as the chair of the committee again. Now she's ranking member, so there has to be political change for that to happen. But more importantly, I think whatever we do, we need to understand that, we have to act upstream. I mean, whether it's kids or adults, if we just screened everybody and then built our mental health care delivery system off the needs of our entire population, this would be easy.
Right.
This really would be easy to do because we would know what we needed. We wouldn't be guessing. And so when we fund things like 988, which has been really important and a real good change, for the better, when we do things like that and we fund integrated services for, in jails and prisons and for people to come out in some communities, come out into the community, when we do things like that, that's okay, but it's tips of the iceberg. And the
Right.
big iceberg underneath is the needs of the population as a whole. And all we need to do is an inexpensive mental health screen, as has been recommended by the Academy of Pediatrics, been recommended by primary care physicians. Screen everybody.
Right.
They say from the age of 12 up. I'm saying from the age of 3 or 4 or 5. Screen everybody. And because these mental health screening tools are easy to use, they can be done in school, they can be done at home, they can be done in physicians' offices. It's not magical. There's not magical stuff. These are well-regarded, effective tools. They're on Mental Health America's website. More than 20 million people have taken a screen on that website across
Me
all
too.
age groups. So yeah, me too, easy. So, I
Yeah.
mean, the idea of saying, let's just adopt this and do this, since the people want this and the people are doing it anyway, and then imagine, take all that information that you get from not just 20 million people, but 200 million people, and, and then use that as the basis for planning our healthcare delivery system. You could put advocates like me out of work that way. You could put a lot of the
Right.
current mental health providers out of
We
work
don't want
because,
we
we
don't
would
want that.
know exactly what to do. And we wouldn't be needed anymore telling people what to do.
And our lovely Corinne is on Mental Health
Yes,
America. She
I
put
see
the
that. Yes, putting up the
she put the
site.
screening.
Yeah.
Yes, guys, literally it's so easy and it's anonymous. Like you'll take it, you just go on there just like if you were playing a video game. Just put some information and it'll tell you. So what for me it was anxiety, it was stress, it was all the things I already knew, but it basically told me what, and like he said, if we had it we do have it at physicians. They are starting to ask, but of course you had to educate them and say, hey, I need the GAD-7 instead, because all they have is, so they're trying, of course I'll say it so I don't have to incriminate you, but I always say big pharma is another business, and of course they're going to try to give us all the same medication, but underneath that we need to find out what the real problem is underneath that, because we can't all take the same pill for different problems, and that's also another conversation for a different day. But you even so hopefully you guys got the information about the screenings. We do need to stop pushing, as Paul said, for our schools, because I in our doc we interviewed some schools in which there's like one counselor to 800 kids, and then that person doubles as a nurse and substitute teacher, and even if the thing that I love when I met Paul was the first example that it doesn't discriminate. It doesn't matter how many, Paul and his first wife adopted, just so you guys know, 4 biracial kids, and we'll get into the situation later. But with him being in the political arena, they had means, they had information, but even then it still doesn't matter. It doesn't discriminate. You still go through the same revolving door as I did, as someone who didn't have anything growing up. Paul said to me one time, he said, and if you remember this, Paul, one of our conversations is something to be said when our loved one will choose recreation drugs over prescription drugs. And it stuck with me because I remember my father going to see him and him being so lethargic and tired because he was on all his mental health meds, which, don't get me wrong, it helps. It does help as well for some people. But when he found out he had cancer and he was protesting against all drugs, that's when I saw the Sicilian dad that I have, the mob boss. He was cursing, he was going off on everything. And I realized, here's a man I just found who's no longer with this 18 years ago, but I was being robbed of this person that I didn't even know he was, because he was so medicated. Talk to me about that. We talked about the ADHD diagnosed with kids, and what should
Yeah.
parents be looking for when they're being told this about their child in school?
Well, I think that, we've been too quick to diagnose every kid with ADHD and then, give them Ritalin, which is a very good drug, or other ADHD drugs. But they're not good drugs if your kid's got schizophrenia, like my kid did. Because they don't work the same way. They're not for that purpose. And I think we need to understand that pharmaceutical companies too produce drugs for certain purposes. And as you've said, if we start giving everybody, these drugs off label and say, okay, we're going to give it, for this, then it's just not going to work. It's not going to be effective. And so what a lot of people do is, they take their own. And I often said about my son, that he's self-medicated. There's no question about that. But he was having, in a sense, a better experience with the drugs that he was using recreationally. And unfortunately, a bad mixture of drugs, led to his death a couple of years ago. But before that, he would keep saying to me, Dad, don't worry about me, don't worry about me. He did not want to take a lot of the drugs that were prescribed for his schizophrenia because the side effects for those were worse than the side effects that he had for his recreational drugs. And the way he felt taking those was worse. Like he said to me one time, I put this in the book. He said, Dad, I don't want to take the drugs. Why not, Tim? He said, well, they make me feel too even. I said, what do you mean, Tim? They make you feel too even. He said, well, they make me feel too much like you. You know, and me, I'm up and down all the time. So I don't want to feel, like you, all even. And but I got it. I kind of understood at that point that maybe we hadn't been as sensitive to his needs. And I often say, there's two people, two experts in the room when a clinician is treating a patient. The clinician has information and expertise that's, a mile wide and a foot deep. Patient's got expertise that's a mile deep and a foot wide. You need to put both together. And if you put both together, I think that points out that, why peers can be effective in treating peers, why you need to have collaborative care with people, because it's useful to have more people kind of involved in this, including involving the person himself or herself or themselves who is the one who really is most knowledgeable about the way these drugs are affecting them, about the way life is coming at them, and they can best articulate what they need and what they want from medication, what they want and need from treatment, and what it is they need to feel like they can succeed in life independently. And it's really hard for us to have asked questions like that. We just haven't done a good job of asking them to
Right.
inform us, and mainly because, and I'll be honest, because a lot of the drugs they take are illegal, and so we don't have good studies
Right.
about these drugs. Even we know so little about marijuana and THC because the federal government still considers it a schedule whatever drug where it's like as bad as anything else, and yet these can be effective drugs for people, and they will attest to the fact that sometimes these things have been effective. So why not open up the arsenal, listen to people, and then maybe we can include more drugs in the formulary than we've ever had, including some now that may be considered illegal.
Right. Right. Not only that, you know what it is, it's all about money
Yeah.
and what they can control and what they can't control. And so, yes, let's talk about this tough part of this whole thing that I was trying really hard not to cry through when I was just thinking it through with Tim. My stepdaughter, Scandia, who actually prompted me to start this live because I wanted to be able to empower her mom with being able to speak about the things that, obviously my journey for the last 5 years. Welcome, Rashawn. I see that you're on here. He spoke at Mental Health America, and he's also in my documentary. Happy to have you here as well. Um, she has told us that she prefers to be out in the streets. She doesn't feel like when she goes through the mental health care system, they leave her on a gurney in the middle of a hospital room. And it just made me think a lot about Tim, who sadly, we lost. I say we because I felt like even though I never met him, I felt like I've always known him through you and your family. And it's a sad ending to something that you have really been on the plate to try to help change. What do you want to share about that? Because it's just such a disappointment to me with all of the work. I'm trying not to cry, guys. With all of the work that you have done and been doing, that the system still failed your child. Paul and his first wife adopted 4 biracial children, as I said earlier. Sadly, one of his daughters lost her battle to cancer, and of course, the world came out. Mariah Carey even met his daughter, and like my family members, the stigma for mental illness is a different thing. Oh, yeah, that's happening. What do you want to share about your journey with Tim? And the other story about Tim, which was so amazing, is that we've always been told that schizophrenia starts at 14 or 20, and in Tim's case, it was at 5. So talk to us about that journey and how, as a parent, because this is happening to so many
Yeah.
parents.
Yeah. Look, and again, this is just difficult. I mean, I wouldn't wish on any parents, what we've gone through. And the fact of the matter is, what Larissa, my daughter, went through with her cancer, and Tim went through with his schizophrenia. I mean, I said to people, they talked one time when they were both ill, And because they hadn't really had much communication, because Tim was homeless a lot of the time in his adult life. They talked one time, and after they got off the phone, I happened to be with Larissa at that time. And just before I hung up with Tim, I'd managed to call him. He had said, I just feel so bad for Larissa about what she's going through. And when I hung up the phone, Larissa turned to me, not knowing that Tim had said that, and said to me, Dad, I just feel so bad for Tim with what he's been going through. And in that moment, it was clear that they both understood living with chronic diseases that were likely to lead to bad outcomes. At that point, they were, we didn't stage schizophrenia the same way, but I would have said Tim was stage 4 in schizophrenia, and Larissa was stage 4 with her cancer diagnosis at that point. It was like they had come together and they understood. And so, but the interesting thing is, they both had a certain amount of celebrity because of my work and others associated with their illnesses. And, you mentioned that Mariah Carey, Larissa got to meet Mariah Carey and stuff that she pulled off. But, but here's the thing, Larissa was featured, right, on the Today Show, right? And so she was featured in a 10 or 12-minute segment on the Today Show. And when she died, she was featured again in a 3-minute segment on the Today Show. Tim was featured in a documentary out of WQED in Pittsburgh, which was public broadcasting. And there's the difference, right? It's like both were kind of, were good things. Both helped elevate the discourse and discussion. But nobody wanted to put Tim into the mass news the same way that you could put Larissa in. And I happen to think they were both really extraordinarily attractive individuals. So he would have played
Yes.
on
Oh my
TV
God.
as well as Larissa would have played on TV. But it kind of gives you the idea about where we still are, and that we've made progress with mental health. It's not covered, and it's not, it's not anymore something you can't talk about. But it's still kind of tough to break through, the smaller audience that's willing to listen and be informed and be educated, versus with something like, metastatic breast cancer, the much bigger audience that there is, and the willingness of people to listen, be informed and educated by Larissa's experience. So I'd like it, but that's my hindsight. That's just sort of what's there. It'd be nice if 10 years from now, both conditions were treated identically. And, insurance didn't treat them identically. The, people who gave to, campaigns and, financing campaigns don't treat them different, don't treat them the same. The amount of money that goes in from the federal government, the state government. I mean, mental health costs about as much as all cancers in the United States. Mental health care and treatment and cancer care and treatment are similar in terms of what they cost. But boy, what a difference there is in the way people look at them.
Right. And so, I just, no disrespect to NIMH, but I'm like 75 years anniversary of researching. Where's the answers? Where are the answers? I'm sorry, even with cancer, where's the cure?
Yeah.
Where are the answers? Why are we still here? How much money does it cost to keep a person in prison? What, $50,000 a person?
Oh, at least. Yeah, at least.
It's like you rather do that because of the private, the private facility, ownership of prisons as well. Do you feel we need to go back to the mental hospital? I mean, but before we go there, my heart goes out to you and your family with Tim, and I will continuously make sure that no matter what I do, his name is heard, because he deserves to be in other platforms besides PBS. And I like to think that he lived his life on his terms, and that to me is something that we don't want to put a stigma on somebody with mental illness, and he definitely didn't have it because he got to live his life his way. And I'm learning that from my stepdaughter. It's like we got to give them their rights, even though it's like parents, we want to fight for our kids to do certain things, but at the end of the day, they know what they want to do. And I always say we got to get out of God's way, and it's hard. It's very hard. But if we do like you were saying, we get at the front end, we get into the school systems, the kids start having conversations with each other because they really are their brother and sister's keepers.
Right.
And we get maybe after school programs to talk about it, or have facilities where they could go, like what LeBron James did with the schools.
Hmm.
Do you think with the severely mentally ill, though, sadly, because they're on a different journey, and I saw a lot of that when my brother had psychosis, the demonic side of all of that. Thankfully, that's not his situation anymore. But what's missing when the adults have already fallen through the cracks, and how can we help them aside from prisons
Yeah.
and
Well,
hospitals?
y- yeah, I'd like to think that recovery at any age is always an option, and that's always the goal. And so the idea that, we should need to write anybody off. I remember talking to a school superintendent once, many, many years ago, who said to me, I already know that there's 100 kids in my school district who aren't going to make it. And
Wow.
and so, and he said, well, we just have to move on from that and accept that. I'm like, well, no, we don't. The reason why they're not going to make it is because the system has failed them. It's not that they failed the system. It's like they're just doing whatever somebody asked them to do. They're kind of trying to live their lives as best they can. And nobody wants to lead a dependent life, right from the start. Everybody wants to lead as
No.
independent life as we possibly can. And that's why our kids, often, like my son too, it's like they turn down treatment opportunities because it's just not what they want right now. And I could have insisted all the time, right? Well, you've got to do this, and what would that have done? As a parent, all that would have done was estrange me from him. And
Right.
and if they couldn't convince him that the therapy they were offering, right, the drugs they were offering, the opportunities they were offering were sufficient, that were better than living on the street, trying to figure out where your next meal's coming from, where you're going to sleep tonight, or anything like that, then there's something wrong with the system. That
Yes.
it's not more appealing than that. So I think,
Exactly.
at whatever stage we're at, even with adults, we just have to understand that we can devise a more appealing system if we are willing to ask people what they want and assist them in achieving their goals. And yeah, it's not a straightforward path. It's not like automatically, okay, let's just set up 3 goals, and we're going to fund those and we're going to give them to you, and now, okay, go ahead and be on your own. It takes a whole lot more than that. But the fact of the matter is, if we're not willing to start there, then we're not going to get anywhere. And right now, I don't think we've been willing to start there with a lot of people, particularly people who are scary. And a lot of people with serious mental illnesses scare other people just by virtue of having the serious mental illness, and not by virtue of who they are. Because, Tim was 6.5 feet tall. He's African American, 6.5 feet tall, and he scared a lot of people. But he was the sweetest, kindest person you would know
Right.
and could know. And he only scared people because they thought, well, what if he freaks out on me? What if he, has an episode, an acute episode when I'm with him? And that was not, you couldn't tell people that's not going to happen. That's not the way schizophrenia worked with him. They were longer periods of time, right? Where he
Right.
was doing relatively well. And then when the psychotic episodes occurred, they were, they built over time. They came to a crescendo. Something happened at that point, and eventually, things worked their way through. The acute episode worked its way through again. But a lot of people just got this misimpression from TV and other things that, they're all psychotic killers, and it all happens within 42 minutes, taking time out for 3 minutes of commercial breaks in between. And you and I know that's not the way it works
No,
for,
not
for
at
people.
all.
Yeah.
Not at all. And that was one of the great things that, you really helped me on the mentoring side of just even with doing the doc, knowing that my dad is just was the sweetest human being, and my brother too. And I think the media does a lot with just showing us just the violence and stuff. But there was even conversation with Nicholas Cruz with Parkland shootings. I mean,
Yeah.
the police visited his house 17 times before he got to that point. So it's like, and I remember in an interview, I believe I put a little promo of it of you in there about that crazy uncle we have. Sometimes those of us in certain families that don't have means, like I didn't, it's difficult for us to figure out, number one, we don't want to get them arrested, you know what I mean?
Right.
So it's
Right.
like you don't want to say anything, because unfortunately, the cops have their own mental health issues that they need to deal with, and then they're dealing with that, and they're only trained to take a person down. and it shouldn't get to that point. What can, you know, part of me trying to do this was just to find answers, to try to help other people to find answers. And do you think we need to go back to the, you know, 988 is great. Those of you that are not familiar, it's a new, it's not too new. It came in the summer. Instead of calling 911, you call 988 so that they know it's a mental health emergency. Do you think we need to go back to the mental hospitals like we had, but obviously in a better way?
Yeah, I mean, the short answer I say is no, that we don't need to go back to those. But then you kind of put that little thing, but in a better way. You know, the longer answer involves we do need more beds. In that people think beds and they think, oh, you know, that means somebody's going to be in there for a long time. No, people have acute phases of illnesses, and occasionally an acute phase of chronic illness necessitates a short hospitalization. But we don't offer that to a great extent with, you know, for people with mental health conditions. And again, partially because of the stigma, and partially because they immediately went into custodial care. And so if we can divorce ourselves from thinking in terms of custodial care when we think of hospital beds or healthcare system access for people with mental health conditions, then we need more. We don't need custodial beds probably, but we do need more places where people can go when they actually have an acute episode until they are past it, until they are through it. And we need effective and meaningful treatment while they're in crisis to get past that crisis stage so that we can then talk to them before they leave and say, what do you want? What do you need from us? And look, we're not perfect at doing that with cancer, with heart attacks, with any of that right now. This post treatment, post hospitalization care or treatment. So we can get a whole lot better at that with a whole lot of conditions right now. But in our case, in our area, they've done nothing. And unfortunately, they created this either or where you've got to be for, institutions, or you've got to be for the community. And if you're for one of them, you have to be against the other.
Wow.
And mine always was that, my view always was that, there's a lot that we need to do earlier. If we do it earlier, we don't face that battle between, do we go to the hospital today or do we not go to the hospital today? But honestly, if Tim ever needed to go to the hospital, I always, hoped he'd get there and get treated there effectively. But I'll tell you, in Tim's case, though, I mean, he occasionally used the hospital, but he was kind of funny. When he was living in Austin, he spent most of his adult life in San Francisco, but when he was living in Austin, Texas, with me, at one point he went into the hospital. He went to the heart hospital in Austin to get his treatment. And I said, well, Tim, what are you doing in the heart hospital? That's not the best one, for dealing with the crises that you're dealing with. I mean, Dad, there's nobody there in the ER. It's a really nice hospital. And I just want the best hospital I can go to. Well, okay, now you have it. People just want the best, just like you and me. We want to go to the best hospital in the area, not the one we perceive to be the worst one. He said, all the poor people are at the other hospital. I don't want to go there. Tim, what do you think you are? But hey, he was smart. People are smart, and they understand that if they're going to work the system, everybody learns. We all learn how to work the system, in our own best interest if we're required to do that and need to do that to survive. And, he did. And but so I'd like to see more healthcare options, more healthcare access, more beds. But I really want to see, more upfront screening, more early identification, and I really want to see more community support services and services that will keep families together and keep people in housing and give people jobs and give people opportunities for education. We need everything. So I'm kind of we need both and. So that's what I've said to people. If they wanted to work on just one aspect of this because that's where their hearts lay, maybe, again, a lot of adults that I knew, their kids were in crisis, but they were adults also. They wanted to work on, can we get more beds? Somebody else, can we keep people out of jail? Somebody else, can we get, do housing? I often said for me, it was about education and helping kids and all that. There's so many places to intervene. So many, and all of it could improve the situation that we have. So I was like, pick one and don't argue with everybody, about this versus that versus the other thing. They'll all incrementally lead us to a better system of care, services, and supports, and that's what we need to be working towards.
Yes. Oh my gosh. There you go. Drop the mic. It's like, like, I know that it's just sad to think that if we have, if we're sick, we go to the ER and, we're waiting for a bed. Then you see people with mental health, issues, and they're sitting in the, they're waiting on a bed, or they're inside, they're in the hallway on a gurney waiting to go to a facility to be treated. Here in Georgia, Grady has a great floor, the
Mm-hmm.
ward, mental health ward, but you are waiting before you can get up there. And even so, they're not, we had a situation, they're not always asking all the questions. They just see how you are now. They don't know where you were before. It could just be you
Right.
took someone's spiked drink and you went down this road. And so it's a sad situation. And what I am really trying to shine a light on is, people like yourself has just definitely been out there talking about it, and then also shining a light on those small pockets of people that literally are doing things that no one knows about, especially for the homeless. Like, how do we get them the information? They may not be able to access the screenings on Mental Health America's websites and things like that. And I'm really pushing for us to do more in the community so that we can get the information to them. The great thing about 2020 was that now we had telehealth care. We could do therapy
Mm-hmm.
online. I know Rashawn, who was on here, he had that set up for his clients. I personally have done it with my own therapist. But we both know it's about what kind of insurance do you have with some of these bigger facilities, and they do with the wallet biopsy, where in some countries mental health care is free. So why are we still fighting this fight? Why are we still having this conversation about what needs to be done? Why do you think they don't want to do it? Is it because it hasn't hit home yet? Like, I don't get it.
Yeah, I sometimes don't get it either because, it's hit home with every family. We talk about ours and it's like, a brother, a son, a parent, a daughter. It hits every family. I mean, half of us will have a mental health diagnosis in our lifetime. So it's not like there's anything mysterious about these or that they need to be swept under the rug. But I think we still have a lot of people who are in denial. And it's a funny thing when policymakers go into denial about the problem here. It always reminds me of the fact that people often say that they're in an acute phase, right? People with mental illness are in denial. They don't know that they're sick. They deny that they're sick. And I often said to people, look, somebody who's having a heart attack often denies while they're having the heart attack. Somebody having a stroke often denies when they're having the stroke that they're having it. But once they've had a chance to calm down, get a little treatment, get a little care, next day they're like, oh yeah, I did have a heart attack, I did have a stroke. It's the same thing with mental health conditions, right? But what's the excuse for policy leaders? That's what I want. What's the excuse for them to deny how big a problem this is, and then to go blame people for denying it themselves? Well, of course, if our public policy is all built around denial of mental health, concerns being major concerns or significant concerns, what do we expect individuals to do if they've got a mental health concern? They're just going to deny it, just like everybody
Yeah,
else.
yeah, yeah. And I know you've talked about being in those positions as a policy leader
Yeah,
and feeling like you even failed your own son,
yeah.
because it's not just you making the decision. It's a bigger picture thing. I guess, what do you think we need to do as civilians to make a change?
Well, we've got to talk about this. We've got to do things like this. We've got to get in front of policy leaders when we can get in front of them. We've got to get in front of advocacy organizations and help the advocacy organizations carry out their work. I mean, the advocacy organizations themselves, over the last few years, even since my retirement, but the 2 years before that, now the 2 years since, have done a lot of work to coordinate their activities in ways they hadn't been coordinated for really generations or decades. So, buying into that and saying, yeah, this is an important thing. And we want the APAs to work together. We want the APAs to work with the NAMIs and to work with the Mental Health Americas. We want the Kennedy Forum to be out there doing its work and working with everybody too. I mean, I think that's important that we tell our advocacy organizations that we applaud their efforts to work together and influence policymakers together. Because again, I don't harbor any ill will toward any other lobbying groups, any other businesses or industries who are involved in this area, but they coordinate a whole lot better than, in a lot of ways, than the advocates ever coordinated. So as lay people, we need to tell policymakers, let's move forward. We need to continue to educate ourselves and other lay people. We need to take advantage of tools that are available to us. And we really have to move the conversation. I keep saying we just need to move the conversation as upstream as we can.
Yes, yes, yes. I'm trying not to take too much of your time, but the thing that you made me think about was I did it, I think that I love what NAMI and Mental Health America is doing. I think that they need to hear more of our stories of those of us on the ground. I've been to some events, even NAMI sadly before David Ralston, who passed the Mental Health Parity Act, the House Bill 1013. My birthday, which is tomorrow, the 1013, ironically. Thank you. This is the best gift ever.
Oh,
He passed it right before I believe he sadly passed away from cancer. I believe that's what it was. But he passed the bill, so Georgia can have the mental health parity looked at. And, I look at states like Florida that have the Baker Act, which I became, familiar with. What do you think about the involuntary hospitalization and, about mental health parity and the Parity Act and what else needs to be done with that? And I know I got you here till 8:30, so I was just trying to squeeze those in.
okay. No, I mean, I think that I'm a skeptic, to be honest, about involuntary treatment. I know that it's worked for some. And so I think it's okay to have it in the arsenal. Didn't do a thing for Tim. When they decided to do it involuntary with Tim, right? He's sitting in jail. And so they're going to do it as an alternative to incarceration. So it's like you can take your, mental health treatment program, or we're going to send it to you, right, to 3 months or whatever it was, 6 months. And so in that instance, they held that over his head and he said, okay, I'll take the treatment, right? 3 months later, he's still sitting in jail. And because they didn't have treatment available for him. And so 3 months, 3 months later, he's sitting in jail. He contacts his lawyer, who called me up and said, I have to apologize to you because, he's got time served now and he wants to get out and just go back on his own. And I said, no need to apologize to me. That's the system again that screwed up, not Tim. And I highly endorse Tim saying, I'm leaving now. You didn't give me the treatment that you promised in return for me to agree involuntarily that I would go into treatment. So what's that tell you? I mean, so for me, if you created enough treatment options so that voluntarily people could take advantage of them, then I think we would do a whole lot better. So I understand that, involuntary works for some. And I think, right now, if that's the best you've got and somebody is willing to do that, willing to buy into that and say, okay, I'll do a so-called voluntary involuntary, then go ahead and give it a shot. But be sure that you're giving them the services they need and not just cookie cutter services that are out there, or don't offer that and then not have the services right in place that somebody is going to need, because that just doesn't work for anybody. And it just and I'll tell you, when it fails once like that, right, there was no way you were ever going to get Tim to agree to that again. And
that's why they don't want
that's
it, because it's
the
not
key.
even there.
It's not there.
Not even there.
It's not there. It doesn't work. And it's like, okay, then I don't want it. And it's like, don't tell me I'm going to do this again, because I know better. I know you're just going to tell me I'm going to do that, and I'm going to sit in jail anyway.
Right. And my brother, God bless, he finally spoke up about his own situation in the dock. And I mean, he basically says it's a revolving door. Why would I request that when as soon as my insurance is done, you kick me out anyway? And my brother went through the jail system too. like you, I know I read you were waiting on that call, which is why I called it the call. It's that call you don't want to get it. You're waiting at night. Just okay, he's in jail. Okay, good. I'm glad. I know where
Right.
he's at. And it's sad that we get to that place, but it's like they don't want to choose anything. They don't want to choose the help because there's no help.
Right.
There's
Right.
no
Right.
help.
And that's the thing. The jail, the institutionalization, that's for our benefit, right? Because we know our family member is safe at
Right.
that time, right? We know they're going to get fed. We know they've got a place to sleep. We know where they
They
are,
can't
and we can go see
leave.
them. Yeah, they can't leave. It's like, so we know they're safe for a period of
Right.
time. So it's not doing anything for them. That
No.
actually is all about us.
Right.
You know?
Right. But like you said earlier, we have to stop looking at them and giving them the respect to make the decision for themselves, even if we know it's not detrimental to their health, but at the same time, it's like what are the options that they have to choose
Right.
from, no matter how much love that we have for them, at the end of the day. So mental health parity, for those that don't know, can you give the viewers just a kind of a brief synopsis, I guess, on what mental health parity is?
Yeah. So the idea was, and that, for the longest period of time, that mental health conditions were simply treated differently and in different systems than every other chronic disease. And the Mental Health Parity Act, now, gosh, the most recent one, 15 years old, that Patrick Kennedy was instrumental in getting passed. And then along with the Affordable Care Act, again, now 12 years old, 13 years old. Amazing that these things have been around for so long. Working in tandem, the idea was to essentially provide mental health treatment similar in insurance programs to the kinds of treatment that were offered for other chronic conditions. There have been a lot of issues with implementing it because the protocols are different, the systems that people came out of were different, and so, this is a battle that's ongoing. I mean, the laws are kind of in place, the regulations continue to be in place, but insurers can claim that they're providing mental health treatment that's similar to the treatment that's being provided by others. But as some have discovered, New Jersey, for example, early on, there was a very good study that was done that basically said, but nobody's taking any patients, and you don't
Wow.
have any providers in your networks. And I think a lot of people still see that. That's like, okay,
Hmm.
my insurance coverage says I've got good, mental health coverage right now, but let me go try to find a psychiatrist or a
Right.
psychologist to treat me. And, you find that there's nobody around.
Right. Because
So that's why, again, and that's where telehealth, I think, has offered some options and opportunities to kind of spread it out, because it was something like half the counties, mostly rural counties in the country, have no mental health providers. And so when you're like
wow.
roughly half of the counties, and the rural ones are big, a lot of them tend to be very large counties, people are hours away from mental health care. So telehealth has helped with that too, early on, but there's still a lot more work to do. In philosophically, we're there, but we're just not there yet in reality.
Right. Right. So I guess the last question is, before Georgia actually signed on to finally get the Mental Health Parity Act in place
Mhm.
again, like you said, even though we have it, in here in Georgia, there's a lot more people like with Care Source. Me being back in school, unfortunately, I said what I have, and
Mhm.
I do have a therapist in the plan, but I know, like you said, they're not getting paid, and that's why they end up not wanting to take those patients, which is
Right,
sad. So it's
right.
like, yeah, you're giving them a bone, but you're not even like following up on that. And so I see you, sis, from my Cali sis, Lachelle. And so thank you for being here. Was another conversation for another day, what they're doing in different states. Why do
Mhm.
you think that, okay, they finally just signed on, but there's still some states that haven't? And what
Right.
benefit is it to them that they don't sign on to be, to honor that Mental Health Parity Act?
Well, but what benefit is, I mean, everybody still thinks you save money in the short term.
Hmm.
And that's a lot of the way. I mean, since I was a legislator for a long time, 11 years of my life, it was, often we worked from election to election. And so if you couldn't show a return in the first couple of years, then a lot of people were not all that interested in spending money or making sure that things happened during that time because they weren't going to get any credit for it. And in fact, sometimes just the opposite. I think now it's even worse. I mean, there's so much in our legislatures, in our Congress too. Well, there are a lot of people, I think, in a bipartisan way would support mental health dollars and mental health systems. It's still hard for people to work across the aisle. It's gotten worse. It's gotten harder for them. And so I think that's been a major obstacle. If anybody, kind of, like we say, like you said earlier with me, it's like I knew everybody. I had all these connections and it made no difference. I used to say, well, that's the good news, right? The good news is, when people said, well, look, if that all happened to you, and imagine those of us who have no, people, no connections. And I said, well, the good news is everybody gets treated the same. None of us are, but bad news is we all get treated lousy,
Right.
And so I think why they don't pick up on this stuff is because they fear that it's going to cost them something in resources. And nobody fears when you build a new road that it's going to cost you something in resources, and all you're going to get out of it is a road, right? That's a little
Right.
easier to travel on, or 4 lanes instead of 2, right? But for some reason, we get held to a different standard, and we have to like demonstrate that we're cost effective, and and all that by within a relatively short period of time, which is next to impossible to do. So people get away with avoiding having to address these issues, but we shouldn't let them.
Yes. And we should be holding them
Yes.
accountable for the road that they need to build for our family members dealing with mental illness, because it's a disease, just like cancer. It's a disease.
Yep.
And so in conclusion, as you heard, we need to get out there and ask questions of our policymakers. We need to start looking into our school systems, in your own kids' school systems, and figure out, what is actually being done. I think even having volunteers, uh, Deb Atney, who's out here, Waka Flocka is her son, he's a rapper out here. She built a little store inside of school so the kids could earn points and be
Cool.
able to buy toilet paper, things that kids in underserved communities like myself, it just
Mhm.
sometimes there's something just like that. So anything else you think in conclusion that we need to do to recap, just some final words on what we need to do, um, for our
Let
families?
me go. Yeah, final words this way. Let's see. I think I can put this into my picture here. Okay, there you go. I'm going to take my head out of it a little bit and show you that. You know what that is? That is the
Wow.
last painting that Tim ever did before he died.
Oh,
And 3 weeks before he died, we got that painting. He showed it to us, and we took a snapshot of it, and and now it's on my wall. It's which is what we've got. And what we need to do, I think, in response is just be creative. I mean, Tim was creative. He figured out a lot of things. Like we'd walk along the road and with homeless people. Tim was homeless in San Francisco. And we'd find him. And Pam and I, my wife, we'd go down. We went with him one time, and he's walking down the road, and Tim just took like all of these carrots and milk, that they were offering for free. And we're like, Tim, you don't need to take this because, you're with us. We'll buy you milk today and we'll buy you food today. He wouldn't eat the carrots. I made him take the carrots, but he didn't want, it's like, Dad, that's too healthy. I don't want the carrots. But what he did was, he walked like 2 blocks and then gave this to a woman who was in more dire straits than he was. And that's what he was doing. He was collecting it to take care of someone else. And what we need to do is learn a lesson from people like Tim. We need to be creative, and we need to be willing to take care of other people who we don't know. This woman was not part of Tim's family. This was not a woman that Tim knew very well. And a lot of us only get involved when it's about our family or it's about people that we know very well. And then we want somebody else to tell us what it is we're supposed to do. And Tim didn't wait for any of that. Tim just helped people who needed his help, and he found creative ways to inform us, to find other people, to build his life, and we just need to do the same thing. So you know, we've talked about, you know, the opportunity around advocacy. We've talked about, you know, early identifications because we've talked about letting people do the things that they're comfortable doing. But the key thing is we need to care about people who we don't know and
Yes,
understand that they're people too, and
yes.
they're grateful for what it is we do for them.
And that's humanity, right?
Mhm.
That's humanity. Yes. I also remember you saying Tim would get an apartment and end up having to get kicked out because he invited all the homeless friends that he had
Yeah,
and people he
yeah,
didn't know to go live there. I mean, just
yeah,
shows you a beautiful heart. It wasn't had nothing to do, like you said, just giving, and that's really all it takes. So his
that's
name
right.
will continue on, and I will make sure of it. I have some creative stuff that I've actually want to come back around and talk to you separately another day, and we will definitely make sure that Tim's memory is alive. Does anyone have any questions on here before we let this amazing force in my life, my mental health guru and illness guru, before we let him go? Does anyone have any questions? I was just trying to see if I could see anything in there. I know sometimes it takes a while for the feed.
Yeah,
Thanks a billion, a zillion, all the money in the world that we need to put into mental health care, plus just for being here tonight. This is everything. It's a personal journey, as you know. Now with my stepdaughter, but I'd obviously someone asked, is the GAD-4 test for anxiety?
yes. Generalized anxiety disorder. It's actually seven questions, GAD 7. You can take it on the Mental Health America website, and you get immediate scores, by the way. If we weren't clear about that, if you take them there, you don't have to give them your name, but you can get an immediate result the minute you take it. So by all means, go there and take it, or get your clinician like I did to go find it out in the main room and offer it to you if you want. You know, if anxiety is the issue. Psychosis, there's a psychosis screen. All of them are there. They're all available. And I appreciate too everybody who's tuned in and participated in this with us. I really appreciate it.
Yes. Tanya Cabral, I see you. This is one of my childhood friends from Fall River, Massachusetts. She said, thank you for making some noise.
Great.
Thanks for being here tonight, Tanya. We go way, 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 way back. So thanks again, Paul, from the bottom of my soul. We will continue the conversation. Is there, we pulled him out of retirement, guys, like Michael Jordan. So, as I
Great.
have events, I'll be pulling him back out again. Look at that.
Well, I don't mind.
I do. I love it. I love it. I love it. Thank you, Gina, and I will look for the. Oh yes, your book. Please, please, please go get the book. I actually just kind of moved, so all my boxes were everywhere, but I have a copy. I've already read it. It's Losing Tim, and where can they find it? On Amazon. It's
Yes.
by Paul Gionfriddo, and you could go on Amazon. Please get it today. Paul definitely looks out for those dealing with mental illness and mental health issues. Again, it's Losing Tim, how our health and education system failed my son with schizophrenia. We didn't even get into, you'll learn all about the 504 and the IEPs and every single thing that Paul and his family had to help him while he was in school. Everything, and it still failed him. So please get it today. Let's support the journey and also in Tim's memory. So much love to you and Pam and everybody. Thank you for being here tonight. Is there anything else that you want to add before we go?
Thank you, Gina, and thank you for doing all that you've been doing to inform people about mental health and the need to really do a better, much better job with mental illness. Thank you.
Thank you. And remember, it's his phrase before the number fours. It's in the promo. Stage 4, coined by this man right here. All right, guys. Thank you so much, Paul. Again, from the bottom of my heart, thank you for being here tonight. Much love
Thank
to you
you.
guys. Thank you guys for joining. I probably will stay on a second later just to make sure you guys have all the information for those of you that just joined. I want to make sure that you also get Paul's book. All right. Have a
Okay.
good night.
Thank
Have a good
you.
night. Thank you. Okay.
Bye.
Bye. Let's see. I know I got to look for my glasses. Thank you guys for being here tonight. Thank you so much for being here. I hope that you learned a lot. And as always, next Thursday, I will be continuing the conversation with Justin Volpe. Justin is has been struggling with schizophrenia, bipolar disorder, and has used his life, his pain for purpose, as I continue to mention in other conversations that's what I'm doing. And he also is what they call a peer counselor for those who are dealing with mental health issues and uses that support. And he's been in two documentaries, one with by Ken Burns, and then I will link that. But I will be sending that promo information out on Sunday. Thank you for joining me tonight. And may God bless you and your family.